Okay, we are getting new reaction tonight to a White House announcement that is raising concerns among doctors nationwide. That's after the president said the FDA would work to add new labels to acetaminophen, known in this country as Tylenol, warning that the use of the drug by pregnant women could be tied to autism in their babies. Catherine Cook has more on how most health experts are responding to that. Catherine?
David, first a little background. The Trump administration referenced a series of studies that found a link between prenatal exposure to acetaminophen and neurodevelopmental disorders. But some doctors point out there are many other studies that have not found a link. They're worried that today's advice from the administration went too far.
We announced historic steps to confront the crisis of autism.
Citing limited research, President Trump Monday said he believes acetaminophen, the active ingredients in Tylenol, increases the risk of autism when used by pregnant women.
So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary.
Physicians were quick to challenge the claim, including Dr. Kavita Patel from Stanford University.
Study after study has actually shown that there's no causal link with Tylenol and pregnancy and autism.
This is fear-mongering about autism.
Dr. Ryan Hassan is a pediatrician at Pediatric Associates of the Northwest. He says the Trump administration's claims about acetaminophen are not only false, they're harmful.
Tylenol is one of the only and one of the safest options for pain control in pregnancy, and that is an essential aspect of necessary health care. Pain and fever in pregnancy needs to be treated with Tylenol, and not treating pain and fever can lead to complications for the mother and for the baby.
Health and Human Services Secretary Robert F. Kennedy Jr. has long promoted debunked theories linking vaccines to autism. He also claims autism can be prevented by avoiding certain environmental factors. Dr. Hassan calls that notion another baseless myth. He notes genetics account for about 80% of autism cases and says autism itself is a way that people's brains work that's different from what is typical.
These fears of autism are largely coming from people who have no experience with this and who are just want their kid to be perfect and don't understand that perfect includes autistic kids. And that, I think, is a big point that is missed in this conversation.
The FDA today also issued a press release noting that acetaminophen is the only drug approved to treat fevers during pregnancy. They also noted that aspirin and ibuprofen both have well-documented adverse impacts on unborn children. David?
Yeah, some really important context there. Catherine Cook in the newsroom. Thanks, Catherine.